Hi, I'm Dr. John Young, founder and president of Foundational Medical Center here in Largo, Florida. And we're going to be talking about high blood pressure. I remember back in my early training, 2,000 years ago, not quite that long ago, but years ago, I saw an announcement that starting in a few months, normal blood pressure was going to be 120/80. Now, we'd been working off 140/90 was borderline hypertension or high blood pressure. And I thought, that's kind of funny. All of a sudden, someone makes a dictate that, hey, in a couple months, we're going to change the normal from this number to that number. And I talked to people and they said, well, at least we'll sell more blood pressure medications. And you know what? They were right. Blood pressure, I think, is one condition that I see most misdiagnosed in my patients that come in to see me. I go back to the Mayo Clinic, and I think in the US, the Mayo Clinic is kind of the clinic for, studying blood pressure. And here's what they said. You can never diagnose high blood pressure at a doctor's office. You need 90 days of home blood pressures or blood pressure settings in your own environment. A lot of my patients, oh, John, the traffic was terrible. I'm sorry I'm late, and I'm all upset that I'm late and whatever. So their pressure's up. Or, man, I was almost in an accident on the way here and the blood pressure is up. So the Mayo Clinic has said you want blood pressure readings in your own environment, whether it's at your house, your local grocery store, your neighbor's house, whatever, and get a variety of them. It doesn't have to be every day. Some in the morning, some in midday, some at night, whenever. And I have been so surprised, and the patients have too, because all of a sudden we have all these blood pressure readings, and they're all look really, really good. So in dealing with high blood pressure, I think the first thing that the patient needs to tell the doctor is, listen, here, I'm going to bring you a number of blood pressures from my own environment, from my own house. And that's going to be the best way to diagnose whether a person has high blood pressure or not. Now, people are all going on this 120/80, and I don't really subscribe to that thinking. The American Cardiology Association paid to have a blood pressure study done a number of years ago. And they said there's going to be no drug company money involved or whatever. It's going to be a 5-year study, not a 30-day study with 10, 20 people. 5-year study, 10,000 patients, male and female, black and white, ages 45 to 75. And the name of the study is the Cochrane, C-O-C-H-R-A-N, blood pressure study. And the results came out about 6 or 7 years ago. And here's what it said. If you do not have heart disease or kidney disease, it is useless to treat blood pressure of 140 to 160 over 90 to 99. And people were dumbfounded. And I saw some of the comments from other doctors, well, it was just a 5-year study. It should have been a 10-year study. Well, 5 years is kind of the gold standard in medical studies. And someone said, well, I've been trained at 120/80, I'm going to stick with that. But here was a huge study done by the American Cardiology Association, which said we can have greater ranges in blood pressure. In fact, if you don't have certain diseases, 140 to 160 over 90 to 99 is perfectly fine. Didn't decrease heart attacks, death, or stroke. Now, the other thing is that, and I still subscribe to the idea that, listen, as you age, you need more pressure to perfuse the arteries. The arteries get stiffer, and you need more pressure to perfuse your brain. So this idea of, I had a gentleman, 86 years old, came in to see me, terrible fatigue. I checked his blood pressure, 117/60. And I said, isn't that a little low? No, my internist is very happy. She wants it low. I said, so what do you do during the day? Well, I wake up in the morning, have breakfast, help around the house, take a morning nap. Wake up for lunch, have lunch, help around the house for an hour or so, go back, take a nap. Wake up, have dinner, up for a few hours, go to bed. And I cut back on his blood pressure medicine. And I saw him after about a couple months, and he told me this, my internist went berserk. I stopped my blood pressure medicine. My blood pressure went up to 126/86. I feel great. I wake up in the morning, I work all day, help with the house, help with the grandkids, all that, and go to bed at 10 o'clock at night because I'm tired. The internist is all upset, but the guy has his life back. Because as we age, we actually need a little more pressure to work properly. So I'm just really saying all this to tell you that just because you don't have 120/80 does not mean you have high blood pressure. There's some very good studies out there. In fact, there's one done by the Heart and Lung Association a few years ago. And what they made their announcement was it needs to be blood pressure of 120/80. 10,000 people in the study, 5-year study. But they didn't release their data. 6 months later, they released their data, and here's what it said. If you have heart disease or kidney disease, 120/80 is what you want. If you do not have those conditions, you can have higher blood pressures. Kind of like that 140/90, which used to be years ago. And I've even seen where they've talked about your age and decade over 90. If you're 81, 89, 180/90 may be just fine for you. So talk to your doctor, because just because your blood pressure is high on an office visit doesn't mean you have high blood pressure. I hope this is helpful, and I'll talk to you later.